I'm Ron Jones. Thank you for joining us for this streaming special of Consumer Stories. You know, each week we're going to hear from viewers looking to keep you and your family safe and ways to save you some cash as well. So that's why we have teamed up with Consumer Reports to test products, alert you to recalls and issues to save you some money. And that includes your options if your health insurance denies you a test, treatment, or medication your doctor says you need.
In 2023, nearly 1 in 5 in-network health insurance claims from plans sold on healthcare.gov were denied. And it was even worse for out-of-network claims, with more than a third turned down. But a denial doesn't mean you should immediately pay out of pocket, or worse, skip the care altogether. Consumer Reports says it's easier to appeal a denial than you might think. First, call your insurance company. Sometimes a simple billing mistake or paperwork error is all that's standing in your way.
Mistakes can and do happen at multiple points in the claim filing pre-authorization process. They can be relatively easy to fix once you identify them.
If it was not a mistake, you have the right to appeal. Ask to speak directly to the reviewer who made the decision and get a clear explanation for why your claim was denied. You'll need this information for the next step, filing a formal appeal stating that you disagree with the decision.
You're going to ask your doctor to write a letter to explain why the procedure is necessary and to include any documentation to help support that, like your medical records and treatment studies, and any communication with the insurance company.
Doctors are used to this, so don't be afraid to ask. The next step might be the hardest, waiting. It could take 30 days or longer for an answer. If you need treatment right away, make sure you request an expedited review.
So if you get a letter that the insurer is still denying the claim, know that both Medicare and private insurance companies are required by law to provide the reason in writing, as well as explain how to appeal the decision with an independent third party.
And if you get your insurance through work, consider asking your Human Resources Department for help. If Medicare denied your claim, consider getting legal help to hear your case before a judge.
You know, there's a law that's supposed to protect you from surprise medical bills, but if you still get one, Consumer Reports says one of the best things you can do is ask for an itemized bill and question every charge before you pay. You know, another annoying situation people are dealing with are these junk fees popping up on hotel bookings, food orders, payment apps, and more. A new federal rule targets some of the worst offenders, but many hidden charges remain legal. Consumer Reports breaks down what this means for you and your wallet and how to avoid them.
Let me tell you about what happened on my honeymoon.
Travel agent Shay Martin recently told her social media followers about the $600 resort fee that caught her by surprise on her honeymoon a few years ago.
I just wanted to share that and let people know that it's something to look out for. And I did call out that it has started to change.
That change is thanks to a new FTC rule now in effect. It requires full price transparency for hotels, short-term lodging, and live event tickets. So you'll know the total price before booking, making it easier for consumers to avoid surprises.
Americans are sick and tired of getting hit with hidden fees that jack up prices and take a big bite out of their wallets. This is a big step in the right direction, but much more needs to be done.
That's because the FTC rule only addresses a small piece of a much bigger problem. Hidden fees are still everywhere. Consumer Reports estimates the average family of 4 spends about $3,200 a year on junk fees.
These added costs hit hardest for families living paycheck to paycheck, especially in low-income communities.
Consumer Reports has some tips to stay a step ahead of some of those sneaky fees. Take flights, for example. You can sometimes avoid extra charges by booking directly through the airline or a trusted travel agent and using the airline's app to check in. Renting a car, you might be able to bring your own toll transponder to avoid extra charges. Just check that it works in your destination and that your state allows you to use it in a rental. Food delivery apps are another place where hidden fees sneak in. To potentially avoid them, order directly from the restaurant, pick it up yourself, and pay in cash. Some restaurants add a 2 to 3% fee when you pay with a credit card. And when banking, switching to a low fee or online bank and using in-network ATMs can save you from unnecessary charges. Smart moves to keep more money in your wallet.
With more consumers paying bills automatically, those extra charges can go unnoticed. So that's why it's really important to check your statements as often as you can. And that's definitely true when it comes to your phone bill, with many people overpaying by hundreds of dollars each and every year. So here's how you can save without sacrificing coverage or reliability.
For years, David Morgan stuck with Verizon even as his monthly bill kept climbing. Like many of us, he was paying more than he wanted for cell phone service.
I felt stuck.
But after 12 years, enough was enough. David said he was through paying for extras he didn't need.
I didn't understand why I was paying so much. I couldn't get clarity in terms of what exactly I was paying for.
It's a common issue. The big three wireless networks, Verizon, AT&T, and T-Mobile, dominate the market. But Consumer Reports says there are other cheaper options. And switching to a smaller one like David did can save you some serious cash. These smaller providers called MVNOs can charge less for service since they rent space on the same networks built and maintained by the big three.
U.S. Mobile, Consumer Cellular, and Ting top our ratings, beating out the big guys on value and customer support.
To find the best deal for you, check your bill or your phone's settings to find out how much data you use each month. You may be paying for more than you need.
Smaller companies typically offer more options, including lower data plans, and some even let you add on data as needed.
Also pick a best provider for your area. Choose an MVNO that uses the same network if you get great service now.
People often worry about slowdowns with a smaller carrier, but you probably won't notice a difference.
To keep your number, activate a new plan before canceling the old one. Make sure your phone is paid off, unlocked, and compatible with your new provider. You'll likely need to install a new SIM card or eSIM. It takes only a few simple steps to start saving. And for David, the switch led to even bigger changes.
When I made the switch from Verizon to Ting, it inspired me to look at other bills that I had, and that included my internet and TV bill.
And the savings by switching keep adding up.
And make sure you take advantage of all the no-brainer cost savings like enrolling in paperless and automatic billing and signing up for any available discounts for seniors, veterans, and teachers. And speaking of smart choices, there's a food trend many health-conscious shoppers are now turning to: cassava, also known as yuca or manioc, which has popped up in countless gluten-free and paleo-friendly foods. But now, a new Consumer Reports investigation reveals some products may also contain concerning levels of lead.
Whether you're reaching for crunchy snacks or gluten-free comfort foods, cassava is showing up in more products than ever. But behind the health halo lies a hidden hazard.
With the exception of some spices, we've never seen lead levels this high as we found in these cassava products.
Consumer Reports tested 27 popular cassava items and found that more than two-thirds contained concerning levels of lead. Lead exposure is especially dangerous for children and pregnant women because it can damage the brain and the nervous system in young kids and developing fetuses. Frequent exposure in adults is linked to immune system suppression, reproductive issues, and kidney damage.
We found that cassava flour, which is often considered a healthy and grain-free alternative, to be especially problematic in regards to lead levels.
CR found that 4 cassava products currently on the market had such high levels of lead that they advise avoiding those products entirely. CR contacted all 18 companies whose products exceeded the lead threshold, but only 9 responded. Some said that lead occurs naturally and is difficult to eliminate. Others said they have been making changes. Thrive Market pulled its cassava chips after internal testing, and it's investigating further. Made Good removed cassava from its crackers entirely, and Lesser Evil is phasing cassava out of its product line. Some brands, including Bob's Red Mill and Pamela's, said their cassava products already carry California's Proposition 65 warning labels alerting buyers to potential lead content. Bottom line for cassava-consuming shoppers?
If you're going to consume products that contain cassava, we suggest that you reduce the number of servings per week.
If you're avoiding gluten, other options including buckwheat, corn, millet, and sorghum have not shown the same lead concerns. And don't rely too heavily on any one food. Varying your diet is one of the best ways to limit exposure to harmful substances like lead.
You know, we want to give our families something healthy to eat, but some of our everyday favorites might be hiding bacteria that can make us sick. An investigation from Consumer Reports reveals last year's riskiest foods and how to enjoy them more safely.
With foodborne illness outbreaks making headlines, some shoppers are being extra cautious.
It's bothersome, so that's why I make sure that I clean all my vegetables and fruit.
We do buy organic as much as we possibly can.
Those are good moves, but they are not enough to protect you. The CDC says tens of millions of Americans get sick from contaminated food every year. Some of it is organic. Last year, recalls linked to E. coli, Salmonella, Listeria jumped 41% compared to the year before, and related hospitalizations and deaths more than doubled.
For seniors, very young children, or anyone with a compromised immune system, even consuming a very small amount of this bacteria can be life-threatening.
Consumer Reports has identified the top offenders from last year: leafy greens and deli meat, onion, cucumbers, and organic carrots and organic basil, eggs, raw meat, and raw milk cheese, and soft cheeses like queso fresco. Contamination can happen anywhere along the food chain, on the farm, during processing, even in your own kitchen.
Recent budget cuts could limit what the food agencies can do. That's why it's so important to know how to protect yourself at home.
To minimize risk, always cook meat to the right internal temperature using a thermometer. Use separate cutting boards for raw meat and produce. Clean surfaces thoroughly. And skip rinsing raw meat, which can spread bacteria. Store meat on the lowest shelf in the fridge and never leave food out for longer than 2 hours or 1 hour if it's hot outside.
Consumer Reports says there are other common foods that can actually carry hidden risks, like raw sprouts, shellfish, even uncooked flour and unpasteurized juices. Another hidden risk: counterfeit products that may turn up for sale on major websites. So here's what you need to keep an eye out for.
Our child car seats protect our most precious cargo. While scrolling on websites like third-party sellers like Facebook Marketplace, Amazon, Walmart, or eBay, you might think you found a good deal, but it might be a dud.
If you end up with a knockoff car seat, you don't have the guarantee that it was tested to meet the minimum safety standards. If you can't find the mandatory safety language, model numbers, date of manufacture, or even the manufacturer's contact information, that's a red flag.
For car seats, there are a few telltale signs.
Some copycat products might have more narrow straps, like what you would find on a stroller or a high chair, and the knockoffs might even be lacking a chest clip.
Before you click buy, make sure the seller is the manufacturer or a major retailer. You also want to buy it in person to ensure that you're getting the real McCoy. Bike helmets are another thing you should not buy from third-party sellers.
Consumer Reports product safety experts recently bought 21 helmets from third-party sellers on Amazon, eBay, Facebook Marketplace, Shein, Temu, and Walmart. 8 of the helmets lacked the required sticker or label declaring compliance with Consumer Product Safety Commission standards, meaning they didn't meet the legal requirements for bike helmets sold in the U.S.
Consumer Reports policy experts say this is unacceptable.
U.S. liability laws are outdated, and online marketplaces often use them to shield themselves from taking responsibility for the safety of goods sold by third parties on their platforms. That needs to change.
When contacted by these non-compliant helmets, Shein, Temu, and Walmart took the images down. The list of the helmet CR bought from eBay was already down, and the company removed its listing for an identical helmet from a different seller. While CR did not find a non-compliant helmet on Amazon in the investigation, a bike helmet sold on Amazon was recalled soon after the study for not meeting the CPSC standards. Meta, the owner of Facebook Marketplace, did not respond to multiple requests for comment.
So if you discover that you've bought a counterfeit, return it immediately and report it to the online retailer. That alert can actually help stop the sale of more fakes and keep others from unknowingly buying unsafe products. Another pro tip: if you're buying clothes online, wash them first before wearing them to avoid a different kind of hidden risk.
Usually I take the clothes and I wash it first.
Anything that is coming from the store, I would like to make it clean.
And that's the right move. New clothes might look clean, but you should wash them before putting them on. Consumer Reports and Trends writer Jodira Rodriguez says you should be washing all new clothing purchases, including your delicates like underwear.
It might seem unnecessary to wash all the new clothes you buy, but there are really good reasons to do it. For example, chemicals from the manufacturing and finishing process can still be on the fabric, and for someone with sensitive skin, that can cause irritation.
That's especially true for babies. Their skin is thinner and more absorbent than adults, which means they're more vulnerable to harsh chemicals left behind in new clothes.
So you're not just wearing a new outfit, you're wearing everything it picked up along the way.
A lot of clothes we buy are made overseas and pass through a long supply chain. Once they arrive at the store, they're handled, unpacked, and tried on. Along the way, they could pick up dust, dirt, and even bugs. So how do you wash new clothes the right way? Consumer Reports laundry expert Richard Handel has some tips.
Wash clothes with similar colors together. Some brightly colored garments can bleed or fade during the first wash. Washing in cold or cool water and the gentle cycle can minimize that and also reduce the risk of shrinking.
Consumer Reports also recommends using a gentle detergent, especially for people with sensitive skin. 2 Consumer Reports top tested picks: Persil Everyday Clean Free and Sensitive, and Costco's Kirkland Signature Ultra Clean Free and Clear. And don't forget to check the care label. Following those instructions will help keep your clothes looking new longer.
From rising prices to job uncertainty and unexpected medical bills, financial curveballs can hit at any time, but having an emergency fund can help make all the difference for you folks. Consumer Reports shows just how building that safety net might be easier and more important than you think.
You probably have Band-Aids in your medicine cabinet, jumper cables in your car, but do you have a financial emergency kit?
More and more Americans are struggling to cover the basics, like rent, groceries, even gas.
Even with unemployment low right now, Bankrate's annual emergency savings report found that 59% of Americans said they couldn't afford to cover an unexpected $1,000 emergency expense. And it's no surprise. Inflation, high interest rates, and unstable income are some of the biggest reasons people say they can't save or don't even try.
Sit down and take a close look at your monthly expenses and look for easy things to cut, like internet subscriptions that you no longer use, or cable or phone services that you don't need.
When you're ready to take the first step, Consumer Reports simple tips can help you start and stick with an emergency savings fund. First, figure out how much you're going to need to cover 3 to 6 months of essential expenses like housing, utilities, food, transportation, and debt payments. Next, open up a separate savings account just for your emergency fund so you're not tempted to dip into it for everyday spending.
You can keep it in a savings account, but your best bet is to put the emergency fund into an account that earns a high interest rate or a no-penalty CD.
And make saving even easier by setting up automatic deposits or transfers from your checking account to your emergency fund. It will keep your contributions on track and secure until you need them.
And if you're struggling with medical bills, Consumer Reports has a very important warning. Steer clear of medical credit cards or loans offered by healthcare providers. They often come with high interest rates, hefty penalties, and could seriously hurt your credit in the long run. For more stories like these, just head to the news section of 11Alive Plus and look for the Consumer Reports carousel. Thanks for watching. We'll see you next time.